We all have mental health. It is important to each one of us. So if you're facing a challenge, you're not alone.
Hi, I'm Muhammad Syahmi bin Miswan.
Assalamualaikum. My name is Muhammad Zulhairi bin Zali.
Hi, my name Muhammad Zulkifli bin Muhammad Nazri.
Hello, I'm Aida Dahlia binti Hassan.
With the tagline, "Show our love and hearts to everyone," this idea has been brought up to attract the interest of health workers worldwide, where it will be seen as an initiative to share the importance of mental health among frontliners during pandemic COVID-19.
As we know, Covid-19 is the most dangerous disease in the new era of civilization. Most of us have their committed experience on how to handle this fatal disease, especially the frontliners who had 24 hours routinely taking swabs and culture this specimen.
Some of our fellows had died due to the COVID-19, and some of them had survived using the ventilated machine. Apart from that, there are still million people out there who have suffered mentally and health because of COVID-19. As frontliners, we also had the same situation. The exhaustion and challenges made the frontliners very depressed, as subsequently can get acute stress disorder.
Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps determine how we handle stress related to others and make choice. Mental health is important at every stage of life, from childhood and adolescence through adulthood.
Not sure if you or someone you know is living with mental health problems? Experiencing one or more of the following feeling or behavior can be an early warning sign of a problem, such as eating or sleeping too much or too little, pulling away from people and usual activity, having low or no energy, feeling numb or like nothing matter, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking or using drugs more than usual.
Those exposed to trauma may develop acute stress disorder and post-traumatic stress disorder (PTSD). COVID-19 related trauma and stress can also result in stress-related conditions include adjustment disorder, depression, and anxiety disorder. Mitigation of multiple risk factors of the individual, organization, or community level can support relapse. Intervention such as psychology, first aid, screening and identify of those at risk and providing peace mental health resources are related to this pandemic.
And continued to be incubated for 3 months. No one had a chance to ask me if I had anyone that needed to be contacted, and I was not coherent enough to give any information. The nurses was amazing. However, I don't remember the doctors that treated me. They obviously did good because I'm alive. It was horrible experience, and not many patients that I was room with survived.
In March 2020, I got diagnosed with COVID. A few days later, I passed out unconscious and was rushed out to the emergency room where they discovered I had developed pneumonia as well. I don't really recall much of my week in the ICU, but apparently, I had a high fever of 39 for at least 3 of those days. Little did I know, after being released from the hospital, the road I would have to face and what came as a result of the COVID. The brain fog, which feels as thought as you can't process reading saying a simple sentence was apparent off the bat. I had this body pain as well as feeling fatigue after the smallest expenditure of energy that's been constant since being released in April 2020. Fast forward to now, I'm on disability. The COVID fever left me with brain damage that causes small seizures. Still can't properly exercise due to lung damage. I also have liver damage from my time in the hospital. All that pales in comparison to the mental side effect of that traumatic experience.
I contract COVID-19 in October 2020. I spent a week in the hospital and at the time thought that was it and that it would be over. In the almost 14 months since, I have experienced issues with breathing, blood pressure issue, weakness, stamina, nightmares, spacing out over it, reading about it, talking about it, possible chance exposure and whatnot. It always being in the news. It always ring topic of conversation. It just made it feel like this thing that came into my life and almost took me and then was just gone. It feel like it took a lot of me with it. I'm not as strong as I was. I don't have the breath or the energy. I stay dizzy now. And sometimes those COVID talk get so heavy and depressing. But I still feel blessed. Blessed to be here with my wife and kids and friends and family. I feel so blessed to have had the opportunity to receive the vaccine and booster, and I am really thankful.
Healthcare workers in a variety of fields, positions, and exposures are reporting anxiety, depression, distress, and sleep problems during the COVID-19 pandemic. Causes vary, but for those on the front line in particular, a lack of opportunity to adequately rest and sleep is likely related to extremely high burden of work, and a lack of personal protective equipment or training may exacerbate mental health impact.
Provision of appropriate personal protective equipment and work rotation schedules to enable adequate rest in the face of long-lasting disasters such as the COVID-19 pandemic seem paramount. Over time, many more healthcare workers may struggle with mental health and somatic complaints.
One of the most useful things we can do right now to address the psychological effect of COVID-19 on our healthcare workforce is to look to what we know from previous experience. Actions frontline workers can take to cope with stress during COVID-19. First, put things in a perspective. Take stock of which things are within your control and which challenge you have no control over. Spend some time each day recounting a few of the things you have accomplished. Second, stay informed. Seek information from reliable sources such as WHO and your local health authority on topics such as case identification, infection prevention and control, IPC, or any topic relevant to your role in the response. Consider taking an online course from a trusted provider and keep these tools accessible in the field. Third, maintain a healthy lifestyle. Maintain a healthy diet, stay well hydrated, and try to get at least a few minutes of exercise a day. Rest during any downtime at work and get enough sleep between shifts. Avoid unhealthy coping behaviors such as using tobacco, alcohol, and other substances.
Avoid information upload. Try to limit your exposure to media coverage as possible, including trust social media. Avoid source of unverified media information and try avoid the spread of myths and rumors.
Positive mental health allows people to realize their full potential, cope with the stress of life, work productively, make meaningful contribution to their communities.
As a conclusion for the mental health awareness of COVID-19 among frontliners, there are a few take-home messages for all of you. First, connecting with others. Second, staying positive. Third, getting physically active. Fourth, helping others. Fifth, getting enough sleep, and lastly, developing coping skills. We expect that this online campaign will have a greater impact not only among frontline workers but also among the general public. With that, thank you from all of us.
Happiness can be found even in our darkest times.
There is still hope. With the help and support, you can recover.
You are important. You are needed. You are valuable. So stand up again. I'll wait for you.